years, football was the focus of Terry Kirby's life, starting with the Dolphins in the early 90s. Being sidelined a few years into his career was an emotional game changer.
So I sat out for like almost over half of a season. Depression started setting in.
Overcoming the blues may have been made easier by Terry's muscle mass. Researchers have found that a muscle gene activated by physical exercise may protect the brain from stress-induced depression.
They looked at a particular protein that is seen in the cells of the skeletal muscle. Those are the muscles that we use to move.
Researchers genetically modified mice to help them create more of a so-called good protein called PGC1A1. PGC1A1 appears to block the transport of kynurenine, a metabolite responsible for depression.
It was very interesting for them to note that they could actually modulate the depression in these animals by increasing the good protein.
Terry says there's no question staying active lifts his mood.
It's mentally one of the probably most satisfying thing for me right now, because I know that every day at 12 o'clock I'm going to train.
The take-home message here is that in some cases, exercise and strengthening your muscles may be as effective as medication for fighting depression. But if you're exercising and still feeling a bit depressed, it's time to see a doctor. You may have a chemical imbalance that needs treatment. With your second opinion, I'm Dr. Ari Soffer.
And the finding may actually lead to more effective medications to treat depression, drugs that can actually work directly into the bloodstream without having to cross over the blood-brain barrier. Janine?
Christy.